Heart disease is the leading cause of death in this country. We have a total of over 30 million adults living in America with a diagnosis of heart disease. If you're born to a family that has been prone to heart disease, the chances are very good that you will experience heart disease. However, if you know you have high blood pressure, you have diabetes, and you are overweight, you smoke, those are the risks that can be addressed and modified. We always tell patients that the best way that we can be able to assess their risk for any conditions, including heart disease, is to generate a very good and thorough history, followed by a physical examination. We recommend that patients see their primary care physicians for routine screenings. Let's say that the patient has not responded to conservative measures such as lifestyle change, modifying your diet, losing weight, exercising, getting rid of cigarettes. Then we recommend that the patient obtain a stress test. And if the stress test is abnormal, usually they'll take the patient to the cath lab. Well, they will perform an angiogram, which is a road map that allows us to be able to visualize the arteries that supply the heart muscle. Then, if there are more than 3 blockages, or there are 3 or more blockages, those patients tend to benefit more from surgery. But initially, if the patient only has a single vessel that needs to be addressed, a simple stent sometimes can help, or medical management along with lifestyle modification. So the best operation to reestablish blood flow to the heart muscle is to perform what we call a coronary bypass grafting, which is traditionally the most commonly performed open heart surgery. What it allows us to do is to bypass using vessels that we take from the leg, such as the vein, and there's an artery that sits underneath the breastbone on the left side that we use to bypass the front or the main artery of the heart. A lot of our patients with heart disease also have high risk of developing aneurysms or dissections. To that end, we have started performing a procedure here called TEVAR, T-E-V-A-R, which allows us to be able to not only address a very life-threatening condition, but do it so minimally invasively by going through the groins and being able to deploy a stent that covers that portion of the aorta. The overall recovery from open heart surgery in terms of the healing of the breastbone is 6 to 8 weeks. Following that, we expect the patients to experience or return back to a normal quality of life. The goals for open heart surgery is to ensure that we do not diminish your quality of life, but enhance it without the prevailing fear that you may develop a heart attack that can potentially kill you. So the recovery from this initially is a little challenging, at least for the first 2 weeks, but following that, it gets much easier and better with the goal towards restoring the patients back to their normal quality of life. I love my job. I would not do anything else. This is what I was called to do. I feel that God led me to do this, and I'm humbled each time that I encounter a patient that I see in my office that I had the privilege of contributing to taking care of.